Welcome to today's webinar presented by SAMHSA's Gain Center with the support of SAMHSA, which is the Substance Abuse and Mental Health Services Administration. Today's webinar is part 4 of our virtual learning community on early diversion and is titled Developing and Maintaining Collaborative Relationships with Law Enforcement That Survive Challenging Times. The presenters today are Dr. Amy C. Watson, Habsi Kaba, Dr. Mark Wooten, and Captain Craig Locke, and I will introduce them shortly. I am Michelle Saunders, and I will be your moderator for this webinar. I am a consultant with Policy Research Associates and have an extensive background in working in both the private and public sector around behavioral health and criminal justice. Before we start our presentations, I have some housekeeping items to review. The views, opinions, and content expressed in this presentation and discussion do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Center for Substance Abuse Treatment, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. If you have any questions for the presenters or regarding the technology, please type them into the Q&A pod on the right of your screen. We will address as many of your questions to the presenters during our discussion group as time permits. We will also be conducting a poll and appreciate your participation. When you see a poll pop up on your screen, please enter your responses. This webinar is being recorded and slides will be disseminated via the Gains listserv following the webinar. We will also notify you when the webinar recording is posted to SAMHSA's YouTube channel. A certificate of attendance will be available for download at the end of the webinar. Please note this certificate is for personal portfolio use only and is not for continuing education credits. There is American Sign Language interpretation for this event. The interpreters for today are Marika Larson and Catherine Lambie. To view American Sign Language interpretation, go to Layout in the upper right-hand corner of the screen. Then select Side by Side for best visibility of the interpreters. There is live captioning for this event. To view live captioning, select the Accept button in the Multimedia pod located in the lower right-hand corner of your WebEx screen. The color contrast of the live caption pod can be changed as needed. The high contrast style is recommended for best visibility. And now I'd like to introduce today's webinar agenda. Coming up next will be Roxanne Castaneda, who will give some comments from SAMHSA, followed by our presentation. And now I'd like to turn this over to Roxanne Castaneda, who is a public health advisor at the Substance Abuse Mental Health Services Administration, for some opening remarks. Roxanne?
Thank you, Michelle. Hello, I'm Roxanne Castaneda, the SAMHSA lead to the Gain Center for Criminal Justice Projects. I'm also the lead for SAMHSA's Early Diversion Project. I want to take a moment to thank the Gain Center, particularly Dan Abreu, Michelle Saunders, and Sam Rogers for their excellent work in developing this event. On June 6, 2021, CBS News Sunday Morning did a special on policing in America. Although public trust in law enforcement has gone up to 69%, according to the Justice and Equal Treatment, it remains in the states. There is a feeling of no more respect and anger coming at law enforcement from all over. Many are considering quitting or retiring early. Police misconduct can be captured on cell phone videos and circulated on social media in a matter of seconds. Reality is, when the system fails in general, people call 911 and it is the police that are first to respond. 20% of that response is with people with mental illness. Although there is widespread crisis intervention training, or CIT training, the general overall police training lasts only 17 weeks versus training, for example, in Europe that lasts 3 months. There is a lot of variance amongst the 18,000 police departments in the United States. In San Francisco, there's a pilot program paid for from the police budget where calls to 911 that are related to mental health issues, about 50,000, bring a street crisis response team. The fire captain in San Francisco is in charge of this team composed of paramedics and peer counselors. They assess and provide linkages to resources in the community and are mostly nonviolent mental health calls. In both law enforcement and behavioral health, there is a need for more cross-training and understanding of the difficulties discussed. In addition, no one could predict the effects of a pandemic on the people served, law enforcement, behavioral health personnel, and the systems we work in. We look forward to the discussion from our experts today. Michelle?
Thank you, Roxanne. Today's presentation is part 4 of the Gaines Center's 5-part virtual learning community on early diversion. Here are the remaining events in the series, and we hope you will join us. And now I'd like to introduce our 4 speakers for today's presentation. First is Dr. Amy C. Watson, who is a professor at Helen Bader School of Social Welfare at University of Wisconsin-Milwaukee and the president of CIT International. She also holds a courtesy appointment in the Department of Crime Law and Justice. Professor Watson has worked extensively on issues involving the relationship between the criminal justice system and mental health systems in Chicago and around the country. Her current research focuses on police encounters with persons with mental illnesses and the Crisis Intervention Team CIT model. Dr. Watson has published extensively on this work and presented findings to local, national, and international audiences. Dr. Watson has also conducted research and provided consultation to programs serving persons with mental illnesses in criminal justice system involvement. These include CIT programs, mental health courts, and prison reentry programs. Early in her career, Dr. Watson worked as a probation officer on a specialized mental health team. She has a BA in criminal justice from Aurora University and an AM and PhD from the University of Chicago School of Social Service Administration. Hapsi Kaba is a co-presenter with Dr. Watson. Since 2003, Ms. Kaba has led the Crisis Intervention Team CIT program for the 11th Judicial Circuit Criminal Mental Health Project in Miami-Dade County, Florida. She began her career in the mental health field in rehabilitation and recovery nearly 25 years ago. As a marriage and family therapist, her passion as an educator and public speaker on mental health has inspired her work to create understanding, compassion, and connections within the behavioral health community, first responders, and society. We are also joined by Dr. Mark Wooten, who is a CIT grant evaluator at the Pine Belt Mental Health Care Resources in Hattiesburg, Mississippi. In that role, he works with groups on federally funded projects such as drug courts, community diversion, and crisis intervention team CIT training. In addition to his role as grant evaluator, Dr. Wooten has worked with the Pine Belt CIT program for the past 5 years, providing both mental health and de-escalation training for law enforcement officers in the 13-county Pine Belt Mental Health Care Resources catchment area. Joining Dr. Wooten is Captain Craig Locke. Craig Locke is a captain in the Petal Police Department in Mississippi and has served in law enforcement for 25 years. He implemented a crisis intervention team and serves as its coordinator. Previously, Captain Locke has served as a police canine handler, motor officer, police diver, CID investigations lieutenant, SWAT team officer, and state fire investigator. He has a passion to reduce crime and social harm, improve police-community relations, and promoting CIT program in today's law enforcement community. So now that we've met our presenters, I'd like to just take a minute and quickly look at our results of our poll. And it's up in the polling off to the right of your screen. This gives us a snapshot of who's in attendance today and sort of where you're from. So it looks like about 39% of our audience is from an urban setting, and then followed closely by rural and suburban areas coming in almost equal. In terms of the field you represent, we've got about 13% from crisis service providers. We've got another 10% from probation, parole, 19% from government, and we've got 18% from community-based, and you can see there's a whole smattering of other professions and areas of work around these issues that have joined us today. So we're really thrilled that all of you could be a part of this great webinar, and we really look forward to some good learning and some good discussion and interaction after we do the presentation. So at this point, I would like to turn it over to Dr. Amy Watson and Hapsi Kaba to begin the presentation.
Thank you, Michelle. So as the title of the webinar states, we're going to be talking about developing and maintaining collaborative relationships with law enforcement that survive changing times. And we're not just talking about changing times, we're talking about some very challenging times that we've seen in the past 18 months, starting with January 30th of 2020, WHO declared COVID-19 a public health emergency. By March 11th of 2020, WHO declared COVID-19 a global pandemic. And of course, we're still continuing to deal with the pandemic and the aftermath for a very long time, I anticipate. Additionally, on May 25th of 2020, George Floyd was killed by then Minneapolis police officer Derek Chauvin. And that sparked protests and social unrest, really demanding changes in policing as well as attention to broader social justice issues. And these two sort of co-occurring crises really created a storm of challenges for law enforcement, mental health providers, and communities, really kind of stressing the importance of having collaborative relationships to really respond in very, very challenging times. And of course, you know, many of us have observed and experienced the impact of these crises on mental health. And these challenges have really been borne out in numbers from a variety of sources. The CDC did a survey of US adults in June of 2020, and in that survey, they found that 31% of respondents indicated that they were experiencing symptoms of anxiety or depression. 13% reported either having started or increasing substance use. 26% reported stress-related symptoms, and 11% of respondents reported having serious thoughts of suicide in the prior 30 days. And what's particularly striking about these numbers is that they're nearly double what we would have expected in the pre-pandemic rates. We've also seen while suicide rates have remained stable, there is evidence of an increased rate of suicide among Black adults during this period. The pandemic has also hit people with serious mental illnesses particularly hard. For example, people with schizophrenia and other serious mental illnesses are 10 times more likely to contract COVID-19. And if they do fall ill with the virus, they are nearly 3 times more likely to die from COVID-19. Additionally, we've also seen significant increases in deaths due to opioid overdoses during this period. So overall, this really documents that even quite early in the pandemic, we were seeing very, very significant impacts on people's mental health, their behavioral health, as well as significant disparities in impact as well that need attention. We also know that there's been significant impacts of both crises on policing. And I believe in mid-2020, IACP, in partnership with the Center for Evidence-Based Crime Evidence-Based Crime Policy at George Mason University, conducted a survey. And they asked agencies to compare April 2020 to April 2019. And what they found in the survey is that overall, agencies reported a reduction in overall calls for service. However, they also reported, almost half of the agencies reported an increase in calls related to mental distress. Additionally, overall, agencies reported shifting to remote response to 10 to up to 30% of their calls for service. So as we moved it further into the pandemic, CIT International conducted a survey looking at the impact of these crises on law enforcement, mental health collaborations, and CIT programs. And what we did is we sent a survey out to our membership and our contact list, really asking them to look at the challenges that they've experienced, as well as the strategies that they've implemented to try to meet those challenges. And I'll talk about each of the challenges that emerged, as well as a really important theme that came out of the survey was the importance of partnerships for addressing these challenges. So the first challenge that came up was just simply the safety for officers and community members related to preventing the spread of the COVID-19 virus. And what respondents talked about was putting into place efforts to triage calls to determine if more calls could be handled simply over the phone or by being transferred to a crisis line or other type of resource. And I think what we're learning from these efforts to triage calls really has value beyond the current crisis as we move towards implementing the 988 crisis line, as well as we're looking to really shift responsibility for response to many of these calls to non-law enforcement sources. The triaging that we've done during this period can help inform those plans and moving forward with triaging calls and looking at alternative responses. We also had respondents talk about their emergency communicators using additional COVID-19 screening protocols so that they could collect information. And if first responders did need to go out in person, they could provide that information so that appropriate precautions could be taken. They also discussed just following general CDC guidelines on masking and distancing, including if first responders had to go out in person to someone's home, officers could ask people to step outside to allow for greater distancing and more airflow, just as a protective strategy. The next challenge that emerged from the responses were just the challenges because of reduced mental health service capacity. And respondents talked about how, at least temporarily, many mobile crisis teams stopped going out in person. Clinicians on co-responder teams stopped going out in person for a period. We also saw a contraction of capacity in outpatient mental health services and inpatient services due to needs for implementing COVID-19 protocols. And to address these challenges, we saw a lot of use of telehealth, where clinicians could provide phone or support or via tablets to officers and other first responders on the scene. saw an expansion of crisis lines, which again, with the implementation of 998 and further expansion in that area, I think these are some things that will have value beyond the current crisis. Additionally, respondents talked about really bringing together partners to communicate and discuss gaps in services and do some troubleshooting so that within the capacity and the challenges that they were facing, they were able to provide the best services available. An interesting theme that came out too is a number of respondents talked about seeing sort of a growth or an increase in informal support mechanisms. So people started checking on each other more often. Faith communities were doing more outreach to support people in the community and really putting those supports in place and perhaps reducing the need for some of the other emergency services. And again, I think one of the I can't call it a benefit of the pandemic, but a positive that may be coming out of the pandemic is greater attention to just broader mental health concerns in the community and greater efforts to provide support to people through some of those natural support systems. Another challenge that people talked about was just how the lack of in-person interaction with program partners really made communication and maintaining of relationships a little bit more difficult. So when people were meeting in person, going to trainings in person, or even responding in person, that provides a lot more opportunity for some informal communication challenges or channels, as well as more opportunities just to informally kind of maintain relationships. And as we shifted over to conducting a lot of our interactions virtually via Zoom or other platforms, we've really had to think about ways of still maintaining some of those benefits that we sometimes get through informal channels and sort of those day-to-day interactions. And what we saw communities doing is doing more virtual meetings, and with the benefit is that it does increase participation and access for people that might not have been able to attend meetings in person even pre-pandemic. And we saw communities starting to hold more frequent meetings of partners to make sure that communication was maintained. And of course, during particularly the initial parts of the pandemic, and as social unrest was growing, things were changing very rapidly. So more frequent communication was often very useful to figure out how to adjust and meet the challenges. Additionally, some communities talked about just sort of the benefit of having some smaller group meetings. They're virtual meetings, but smaller and more frequent to maintain communication and relationships. And overall, really what seemed to come through is that because these interactions were now virtual and different, more attention had to be paid to making sure that we structure our interactions and make them frequent enough that we can maintain those partnerships and communication. So it might take a little bit more work, but many communities were able to adjust. So we also saw a number of participants really talked about the stresses on first responders. And the quote at the bottom half of the slide, I think, really kind of sums it up, just about how stretched, stressed, and exhausted first responders really were. And so things that the communities were starting to do to address this, participants talked about mental health providers developing wellness and self-care webinars for first responders. Also, mental health partners offering no-cost support for officers and their families. So the mental health partners really stepping up to support law enforcement and other first responders. Additionally, we're seeing agencies expand EAP and peer support services, and also expand their efforts to make sure that people were aware of what services were available and to encourage them to engage in services if that's needed. We also saw people talking about communities stepping up to offer basically sort of appreciation to first responders in the form of free meals, special shopping hours, as well as offering some alternative housing for first responders that were concerned about going back and forth to their homes if they might have been exposed. And of course, we did have a few questions in the survey about challenges due to the social unrest, and people did talk about sort of having that heightened police community tension. And a theme of particularly some of the providers talked about just an increased fear of police among their clients as well as some of the providers. And I think this quote, I think it's striking. It's really talking about how the crises have really elevated people's feeling of fear and hopelessness, and really having an impact on their clientele. And really overall, strategies to address this, as well as all of the other challenges. Respondents repeatedly mentioned just the value of the partnerships that they had prior to the pandemic and how useful they were of really bringing people together to respond to the challenges, but also talking about how the pandemic and the social unrest really kind of pushed them to strengthen the relationships that they did have with their partners. And there was a few respondents that talked about how they didn't have much in the way of partnerships prior to these crises, and they really had to scurry to get them put into place. But now that they have these partnerships, they see the value really moving forward beyond the current challenges, and really putting them in a good position to address challenges going forward. And now I'm going to hand the presentation over to my colleague, Habsi Kaba, who's also going to talk a little bit more about some of the strategies that are being employed.
Thank you, Amy. I am having difficulty with my video and starting the video. So I apologize for that. I'll keep attempting, but let me move along here. I do not have, there we go. Now it's kicking in. I apologize for that, folks. Okay, thank you very much. So I had an opportunity in my role as the CIT coordinator here in Miami-Dade to continue working so closely with all of our 36 agencies, police agencies in Miami-Dade County and our 14 crisis units. As well, I'm fortunate to be able to work with our Florida CIT coalition, state coalition, as well as a national level with the CIT International Board. And so I was able to provide you today with a snapshot of a number of different communities throughout our nation, more specific to what Amy was sharing with you. So for example, some of our partners in California in the State Council on Development of Disabilities in the Sequoia office, you know, we all had to become very creative, and we very shortly began to use Zoom and other platforms to communicate and connect. And so since so many trainings were on hold, the State Council created videos that they could share of stories by persons with lived experiences and be able to send that out to police departments and different behavioral health agencies to continue to provide at least some aspects of training. Here in Florida, one of our Collier County, one of our counties, Collier County Sheriff's Office, their CIT training for mental health and social service staff launched mental health first aid training for agencies and staff in jail population. Internally, they did continue their training, but of course, CIT training, the 40 hours, was placed on hold. But during this time, they had an opportunity to expand their de-escalation training in-house. In Miami-Dade County, we knew that officers, you know, they don't stop. Law enforcement doesn't stop. As we were sheltered, they have to continue. And so, of course, they wanted to continue training. I wanted to make sure as a CIT coordinator that we remained in touch, in contact, and connected more than ever during the pandemic and social unrest. So what we did here in Miami-Dade County was we developed 8-hour intros to CIT and 8-hour refreshers virtually. So we absolutely, it is not recommended nor is it effective to provide the 40-hour training virtually. It just doesn't work. And so we made sure that at least some components continued as far as keeping connected and advancing the learning of our officers and refreshers, of course, for our CIT officers. And so as well, we made sure that we continued the cross training and kept our community and our professionals, our partners of law enforcement connected. So we as well continue to have virtual CIT orientations and including our professionals, mental health professionals, our outreach workers, homeless outreach workers, still at least connecting through a virtual platform. In Missouri, Kansas City Police Department, officer wellness videos were created to increase awareness and support. And so they created a series of a number of different wellness resources, techniques, and collaboration with behavioral health, and produced these videos and had them available for all of our first responders. In Collier County, the Florida Sheriff's Office, they when they hold someone under involuntary hold, they would most commonly, as many of us do, manually complete the state mandated, the legal document, and walk it through when they made contact and handing the person to crisis. Instead, of course, all of our facilities, all of our crisis facilities had to, of course, implement COVID procedures for safety for everyone. And so we also wanted to do our part with law enforcement and make sure that any of their procedures that we could expedite, that we would make sure we would implement. And so Collier County and Miami-Dade County and some other of our communities, law enforcement, work together with their crisis units to develop a procedure for an electronic submission. So when the officer arrived with their person, the paperwork was already there, and it would cut some of the time that they actually spent there at the facility and expedited the process. In Kansas City, Missouri Police Department began to use tablets to connect with mental health community liaisons and the community. And we found that some law enforcement agencies prior to COVID did not really see the value. But of course, under these extreme measures, they said, let's try it out. And because of the pandemic, they began to use tablets to be able to connect our mental health professionals on the streets with people in the community. And so now it's just part of their procedures and their approach and connection with the community. The city of Orlando, Florida, and Aspire Health Community created a response team pilot. And so this will be a non-law enforcement, one of their pilots will be a non-law enforcement crisis response in the community. In Miami-Dade County, our 911 Communications Center, again, to expedite the handoff for officers and to assist facilities to prepare when they are bringing someone under involuntary hold. Now, once the officer is en route to the crisis facility, our 911 Communications Center will make a call to that particular facility and give them heads up that an officer is en route with a person in crisis and under involuntary hold. Orange County Sheriff's Office and Devereaux Behavioral Health Response Team has also been developed during this time, and they too are developing a crisis response that is behavioral health focused and non-law enforcement. During this time as well, what a great opportunity to connect more so with the community. And of course, since our meetings, we heard some communities paused with their CIT steering committee meetings. But for example, here in Miami-Dade County, we just went virtual. And Orange County, what they did at that time, not only do they have their sub meetings, but they developed a new Central Florida Law Enforcement and Mental Health Coalition. In Miami-Dade County, our steering committee meeting prior to COVID, we averaged 60 partners, an average of 60 partners and stakeholders at our meetings. Well, with our virtual CIT steering committee, we had to upgrade our subscription to Zoom because we had 100 plus participants in our meetings. And so we just grew and it continues to grow. So we were really happy about the benefits of a situation when, there's crisis. We can always be creative and many great things can come out of it. During this time, of course, we found that there was a great need to focus on emergent needs in the community. And so through our CIT steering committee, we developed 4 subcommittees. And those 4 subcommittees, there was just no hesitation from our partners from all disciplines to join the law enforcement, officer military wellness committee. We developed a community and outreach and development committee, as well as a CIT expansion training and education committee. And then lastly, our CIT youth task force. We found that in Miami-Dade County and throughout the state of Florida, our responses, law enforcement and mental health responses to our children increased significantly to the extent where our facilities, our youth unit, our juvenile unit facilities have been overflowing. And so our hospitals have had to transfer our children to other counties, to the next county, trying to locate a bed. And, of course, we need to get to the bottom of that and not just create more beds or more facilities, but where is it stemming from? Why is this happening? And I found across the board so many law enforcement and mental health medical professionals. I was just receiving more calls for referrals to therapists and for some assistance with mental health. So these 4 committees, subcommittees are hard at work, and especially our youth task force trying to meet the needs of our children and provide the community resources to our schools and to families how to better address this need. Collier County Sheriff's officers examined and expanded all response to their resistance policies and procedures, perhaps better known to others as uses of force, and looking at those policies and those procedures and incorporating and expanding de-escalation training. Here in Miami-Dade County, we launched our first Office of Equity and Inclusion to open doors to economic prosperity. And this office will work across county departments and collaborate with community stakeholders to normalize and implement the principles of equity and inclusion in government and beyond. Another focus the main focus, of course, is racial equity and expanding access and economic opportunity to all groups to level the playing field, including women and LGBTQIA community and people with all disabilities. We will be measuring performance and progress to create accountability and build programs that support and strengthen our small businesses ecosystem. Phoenix, Arizona Police Department community liaisons during the social unrest and protests. They walked these liaisons, these police community liaisons walked in marches with protesters, and they spoke with them out there during these marches and answered questions, and also offered to set up meetings to discuss concerns. And it really just really inspired me to see some of the pictures sent by Arizona Police Department of these officers in the community, hand in hand with our community members, and working towards peace and prosperity. And it was truly inspiring. And so what I find here is that we have a true alignment and collaboration of where we were in crisis and in chaos. And we are all more, I find that in my research and speaking with so many other communities, that we're better understanding each other's roles, and creating understanding and compassion and empathy. So thank you.
Thank you, Dr. Watson and Hopsy. And now I'd like to turn things over to Dr. Mark Wooten and Captain Craig Locke for their presentations.
All right, thank you so much, Michelle. Well, as Dr. Watson kind of gave us a real big picture overview of the changes that took place due to the COVID-19 pandemic, and Hopsy gave us some specific community interventions that happened, Captain Locke and I are going to attempt to give you a real snapshot into how our specific program here in the Pine Belt of Mississippi adapted and changed due to and because of the COVID-19 pandemic. So here I'll give you a little bit of background on our Pine Belt CIT program, so you can kind of know where we came from and how we progressed over the years. We started our program in late 2015. At that point, we sent our first 3 officers to a training facility in a different part of the state, because at that point there was only one training facility here in Mississippi. So we started out with 3 officers from one agency in one county, and that was the seed for what would become our crisis intervention team program. We did our first in-house training with our own team in 2016, and by 2019 we had hit our training peak. We trained in that year alone 121 officers over 30 different agencies and 10 different counties. So we had really expanded our program. We had a lot of momentum. We had a lot of push in the community and a lot of real support from our law enforcement agencies, from our community partners, and from a lot of different folks there. You can see here our Pine Belt officers had responded to over 1,300 calls. I looked today at our system, we're about to approach 1,500 calls, and 74% of those contacts have either been de-escalated at the scene or transported to a single point of entry. So we really felt like we're making a lot of difference in our communities. Our officers are out there doing good work with the CIT program. But of course, everybody knows 2020 happened, right? Well, we were prepared for a great year to capitalize on the momentum of 2019. We had a full slate of trainings scheduled in 2020. We got one done in January, and then things changed. There was a lot of confusion to begin with. You know, we had to sit down and think, how long is this going to last? How bad is this going to be? Is this 1 week? Is this a month? Is this a few months? How is this going to affect our training going forward? Very quickly, we realized that all of our trainings were going to be put on pause indefinitely because we didn't know what was happening. So we had to clear our slate of training, had to clear out all of the appointments we had, all of the trainings, and that really felt like a blow to our momentum, right, to our training, our community development. But what we knew was that training was still vital. It was important for us to get this program out into the hands of officers and into new communities. So we had to figure out a way to do that. If anything, need for de-escalation training was increasing as hospital beds filled up, as officers were inundated with new tasks, with a shortage of workforce. We knew we had to work even harder to make de-escalation happen in our communities. So we had to find ways to keep going with our training. So once the initial confusion started to settle down, we got together as our small training team, so our mental health CIT coordinator, some of our law enforcement coordinators, Captain Locke being one of those, and some of our main trainers got together and thought, how do we continue training? We reached out to CIT International. I think Hopsy mentioned this earlier. Virtual 40-hour CIT training was really not a viable option. It's not going to work as well as the in-person training. So we knew we had to find a way to continue our trainings in person if we were going to continue our 40-hour CIT training. So we had to think which parts of training are necessary. We got together, we looked at our 40-hour curriculum, 5 days worth of training, and thought, what are the core elements of this training? And then what are the extracurricular things that we do because we can and because they're useful, but not necessarily the main core elements. And then we looked at all of our training modules and thought, what kind of modifications can we make to make these more applicable to the current environment? And what modifications can we make to make those safer for our students and participants? And once we had figured out, one, that we wanted to continue training, and two, make some decisions on what was core and what was extracurricular, we thought, what kind of buy-in do we have? Because with CIT, we preach community. It's community partnerships. And even if as a training team, we wanted to continue our training, we knew that if there was no community support, community buy-in, the training would not be effective long-term. So we thought, do we have mental health buy-in? Do we have community buy-in? And then do we have law enforcement buy-in? Because we knew if those agencies were not on board with us, it was going to be very difficult to keep that momentum going. So Craig, you may want to talk about how we had law enforcement officer buy-in at that time. Was it easy to get that from your perspective as the law enforcement side of training?
What we really had to work on, we had to concentrate on trying to get the officers more involved in it and explain to them how that we were making the training and everything as safely as we could during the crisis we were all facing. But it seemed like that even though that was probably one of the few challenges they had, but it was an overgrowing amount of challenges that everyone was dealing with, we did end up having a really good buy-in from the law enforcement community.
Yeah, after we really sat down and explained what was going on, what our plans were, we had a great buy-in from all of our local agencies. So we really got some good momentum building from that. So what did we do? What were our outcomes here? So the first thing we did was modify our policy, right? So right off the bat, when you came in the door for CIT training, you were going to get a temperature check. We were going to make sure you had some kind of face covering on, right? That was straightforward CDC guidelines, no problem there. We took our class sizes, and we had been running 15 to 18 participants in our classes, and we knocked that down to shooting for 10 or 12 participants. We knew that the facilities that we had access to only really had the room to accommodate that many students. And then we changed our classroom arrangement. So previously we had used kind of a horseshoe-shaped class, a big U of tables. That way we could have presenters in the middle of that table. We could do our de-escalation role plays in the middle of that horseshoe. And it was very easy for people to see, for people to hear. And we could seat our officers pretty close together. We could make sure that folks from different agencies were next to each other. We could kind of encourage some of that communication and partnership building. We switched to more of a lecture style classroom setup, right? Everybody had their own individual table. That way we could make sure that appropriate space was maintained there. We also had to limit our faculty. Previously, we wanted to have as many different individuals come in to provide instruction as possible. We knew that the more people came in to provide training, the more partnerships we could form with our students. They would get to know more people from the mental health field, from community agencies, from law enforcement. But what happened was we had to look at our training staff and think, how can we cover the most ground with the fewest number of trainers? And that required some of us to pick up extra modules, things that we had not instructed on before. But we were able to do that as a training team so that we could have the fewest number of people involved in the training and minimize person-to-person contact at that point. We also limited the amount of folks who were coming into audit. We would oftentimes ask our crisis response team members to come in and meet the officers, talk to them, get some names with faces there. We really had to lessen the number of people who were coming through the door for our trainings, which was difficult for us because we like to have that. It was very beneficial, but we knew that for us to do training at all, that was going to be the way that we had to do it. And then we used some virtual options when possible. So even though we couldn't do the whole training, virtually, we knew that we could do things like virtual site visits. At one point, we had a nurse from one of our crisis stabilization units holding up a computer, walking around on Zoom to show our officers what the crisis stabilization unit looked like and what they could expect to see when they brought individuals there. We also had some folks with lived experience come in and talk to our officers through Zoom. We found that that was one of the highlights of our training, one of the real points where minds started to change about individuals out in the community, and to have them come in and speak to our officers and answer questions was a very important part of that training. And so to be able to do that through Zoom became a useful piece of technology that we could use to implement that training aspect even virtually. Some of our learning activities, right, we had to decide what remained the same. So we do an activity where we use earphones and an MP3 player to simulate hearing voices. And we decided that was a very important part of our training, and that stayed the same. We continued to do that. Things that we modified, right? We modified some of our different activities so that there was less person-to-person contact. And then some of our activities we just went and eliminated. We knew that they were useful and beneficial, but they were not beneficial enough for us to continue doing. So we had to go through our list of different modules and activities and think, what can we keep and what can we get rid of? Role play. Role play is one of the core elements of our CIT training, right? That's the point where things really start to take shape. And so we wanted to make sure that that was realistic but safe. We worried at first that folks having masks on or having to keep distance was going to decrease the effectiveness of our role plays. But really they increased it because that's how our officers were seeing people in the real world. So that became more applicable to the state that they were actually in when they were on the job. And so that worked out for us. And then graduation. Graduation is one of those things that we tried to make as big and important as possible. We wanted the officers to feel like when they had graduated this program, they had really made an accomplishment. And so we tried to do that even though we couldn't have a lot of people in the room for graduation. So we would hold the normal graduation ceremony with just our officers and a keynote speaker, but then we would broadcast that graduation through Zoom. So we would ask all of our students to give those links to their family, to other officers, to their commanding officers, and have that broadcast to the community, even though they could not be there in person. And really overall, we tried to turn our negatives into positives, right? We knew that with smaller class sizes, we could have more student interaction. And rather than have 18 people we had to get through role play and answer questions for and try and manage those interpersonal relationships, when you have 10 people, it was a lot easier to do that. So we could spend more time on those individual questions. We could spend more time dissecting role plays and getting a more intensive classroom experience. With fewer training scheduled, we had the opportunity to develop new ideas. With this time, we developed a CIT for dispatchers training. We took our normal CIT for officers training, modified that for our dispatch supervisors, and were able to provide that training to them. We also were able to provide or to begin a Pine Belt CIT Facebook page. This allowed us to provide community information in a wider area. And then finally, the elimination of training pieces helped us hone in on the core aspects of training. It's really good to have a lot of different activities and extraneous things that we do in training, but knowing what the core elements of training are is very helpful going forward. And we can use that information even as things start to open up more. So what we had to remember was that even if training wasn't happening the same as it was still happening, and that was important. You know, even if we were training at 80% or even less than that of what we wanted to do, it was better than not doing training at all, and that was important for us. The practical things that we had to address in our classrooms that were happening out in the real world, we knew that crisis stabilization units and hospitals were having limits, right? They were filled up with individuals with COVID-19, and so there was not room for them to be used as mental health stabilization beds. And so that really put a highlight on the fact that we did not have a lot of crisis stabilization or mental health facilities for folks who needed de-escalation a little bit longer term. And so it highlighted the need for more of those beds and gave us a real impetus to start working towards getting more community diversion in place in our counties. We saw a lot of increased calls involving suicidal ideation, specifically mentioning COVID-19. And so we were able to bring that back into our classrooms and make that a specific training point for our future classes. And then there, as we know, there was a lot of increased public scrutiny of law enforcement officer decisions. And so Craig, you can kind of cover what it was like, what it is like to continue to be an officer in this time where there's a lot more public scrutiny there.
Well, it's definitely the scrutiny's out there for our officers, and it's become harder and harder for them to do their daily jobs and everything like that. But we've really tried to direct the officers' thoughts and processes of all the public scrutiny of their officers, and we're trying to redirect everything towards more community-based policing tactics and things like that, to try to promote more community activities together and things like that. And at some point, I'm hoping, since maybe the COVID regulations and everything is lightening up towards things like that with the community, where we're not having to change so many policies the way we're normally doing things, that maybe some of these situations and everything, some of the tensions will just ease throughout the communities.
Exactly. Again, with communication, again, we push community partnerships as a core element of our trainings and of our program. So I think Dr. Watson covered a lot of this. We had to keep communication open. So we had to identify our key partners, right? Who were the folks who were making the biggest impacts on training and pushes in the community. And then we had to make sure that information was flowing between the training groups and different community agencies. We use a lot of virtual options for our communications, right? We were able to use phone calls, Zoom meetings, and even the newly formed Facebook page for our Pine Belt Crisis Intervention team. That became a central point that we could direct people towards to get information on upcoming trainings, information that was happening, and that was very helpful in our being able to get information out to the community. And the idea that we could break large groups into smaller groups. And Dr. Watson covered this very well, right? We can compartmentalize those different aspects of those group meetings so that the people who need different parts of information can have that information as they need it. But we know that not everybody has to be available at the same time, right? So we could get people the information that they needed when they were available to meet with us and have that information. And then it really drove home the idea that some meetings could probably be emails in the long term. And I think we've all probably experienced this. You get to a meeting and you think, we didn't really need to get together for this particular dissemination of information. So we get a lot better now at understanding what things can be done through email and what things really need to be in person or Zoom, where we can really converse in that instantaneous fashion. And then our final takeaways, we know that virtual doesn't replace in person, but it can be useful. And so a lot of those things that we implemented during the COVID-19 pandemic, we can continue to use throughout our trainings going forward. Communication is really the key. It's hard to expect your community partners and your law enforcement and your mental health to all be working together if they're not communicating. So you got to find ways to have that communication between your different community partners. And then lastly, CIT training is vital. It's important for our communities to have this training. And so finding a way to get our officers this training was a key area of importance for us. And so we were glad that we were able to find ways to do that and have the buy-in in our communities to maintain and continue that training. Thank you, and I'll turn it back over to you, Michelle.
Hi all, this is Sam Rogers from the Gaines Center. I believe we've lost Michelle, at least temporarily, so I'm going to fill in for her here. So thank you to Dr. Wooten and to Captain Locke. We're going to move shortly into the discussion group portion of today's event and have some time to address your questions from the audience. If you've not already, please type your questions into the Q&A pod to the right of your screen, and we'll answer as many as time permits. Again, we want to remind you there is a webinar attendance certificate. If you are interested in downloading that for personal use, you can do that now. You're going to see a file transfer box appear on your screen shortly, and I will put the certificate for you to download in that. So under file name, you can click the file. It should turn blue, and then the download button should turn a darker gray. When you click the download button, it should initiate the process to download the certificate directly to your computer. Now, if you're joining us from a mobile device, you might not be able to see that file transfer box. If you can't see it for whatever reason, you can email me, Sam Rogers, at srogers@prainc.com to request a copy. And I will put that in the chat for you. So now here is some information for you all on an upcoming webinars hosted by the Gain Center. On June 29th, there is part 3 of the MAT in Drug Courts virtual learning community, focusing on the NADCP's MOUD toolkit. On June 30th, there is part 2 of the teleservices in Drug Courts virtual learning community, focusing on planning for teleservices by assessing needs and identifying opportunities. And on July 27th, there is part 3 of the teleservices in Drug Courts virtual learning community, focusing on implementing teleservices for court proceedings and treatment. Registration information for these webinars will be shared via the Gains listserv, so please keep your eye out for that information, and we hope that you can join us.
So Sam,
Yes.
I think Michelle's trying to connect by phone or reconnect by video. Until we hear from her, I'm happy to lead the discussion
Great.
portion at this point, if you'd like.
Yep, I'll just finish up with these announcements here, and then I'll turn it over to you, Dan.
Okay.
So if you haven't signed up for the Gains listserv, I encourage you to do so. Here is a link on the screen. Just enter that link into your favorite web browser, and it will take you to a place to enter your information so you can make sure you stay up to date with all of the Gains Center's activities. Thank you again for your participation in today's event. If you have any other questions or comments, the Gains Center's direct contact is here. You can go to samhsa.gov/gains-center, or here is a phone number to directly reach us. If you'd like to stick around for the discussion group on today's webinar, we encourage you to do so. So we will now begin the discussion group portion of today's event. We might not be able to get to every question, but we'll attempt to answer as many as time permits. So Dan, I will turn things over to you.
Okay, thanks, Sam. And Michelle, do we have you on the phone already? Okay, so I'll continue until we hear from Michelle. So let's start with a couple questions that have come in on the chat, and there's a couple questions that have to do with training. So one of them was, has anyone ever done a series of 8-hour trainings instead of the full 40-hour week at once CIT trainings? That's actually been kind of a long-term question CIT faces, especially for rural communities where they can't really get a significant number removed from duty for the week. But it's certainly been an issue during the pandemic, and with people having to adjust schedules and having having access to trainers on site and social distancing and all those issues. So, you know, there's a lot of discussion about going back to normal, and there's a real question about, well, should we? You know, should we be more flexible with some of these new things that have been thrust upon us? So I'm gonna start out with you, Amy, and get what some of your thoughts are about the 40-hour block of training. How is the hybrid training working out? Is that something you see moving forward?
So I mean, the original idea with the 40 hours being in a 1 week time is that it's really an immersive experience. And, you know, I believe that there's value in that. Also recognizing that there's challenges, particularly in rural communities, for actually providing CIT training that way. There is one study that I've seen that has looked at a segmented training. I think the lead author is Gary Kudabak from University of North Carolina. And you know, they segmented the training. I think it was 2 and 3 days. And they saw, looking at, you know, knowledge and attitude gains, they saw similar outcomes as you would see when the training is offered in a 1 week time. Now, if I put on my CIT International hat on, though, we really don't encourage breaking up the week because we do think that there is value in really having that 40 hours in a 1 week period. So, you know, certainly there's adjustments that get made as agencies try to figure out what will work. But ideally, having that 40-hour week in a 1 week block is kind of the preferred approach. Likewise, I know there's a question about, you know, if some portions of the training could be provided by video. And I think I would not encourage that, because one of the pieces of CIT is bringing in your local community content experts. And that allows for, one, the information to get conveyed to the people in the class, but also for the officers to meet providers from their community and have some interaction with those folks, and you start to develop relationships there as well. And by simply providing videotaped components of it, you lose that opportunity. And I've seen places that have done a videotape of the person with lived experience, and I think you really lose something because you can't have that interaction piece to it.
Oh, well, thanks, Amy, for that summary of concerns. And it's interesting that I wasn't aware that there's actually some research on that. So that's always helpful to inform teams also. So Hapsi, as a CIT coordinator, what's your thinking moving forward around training and using virtual methods versus you're going to go right back to normal, and
December 14th.
You're scheduling going to try to do some creative things.
I coordinated a 3-day training CIT for communications, and it was in the classroom, and it was just so good to be back in the classroom. And you almost forgot that, you know, we still need to be very careful, because I wanted to hug everyone, and it wasn't just me. It was just really that warmth, that human connection. And then last week I spent a day with officers, and so, you know, they're all saying, you know, we're losing the connection if we have to get online. Sometimes we're not even listening, you know. And so I completely agreed. Years and years ago, when we first started our program in Miami-Dade County, you know, one chief kept saying, can we just try this 1 day a week for 5 weeks? And I said, Chief, it's not going to work. And so I did give in. And, you know, I'm so glad that I did, because at the end, the chief said, yeah, this doesn't work. This doesn't work. You know, we lost the continuity. We needed to go back and remember what we talked about last week. It just did not work. And so that the chief himself said, no, I'm going to make it happen. And, you know, they even host many classes, you know, now. And as far as, I just wanted to piggyback off of Amy, as far as, you know, making sure that we have people come in to the classroom, Yeah, CIT is a community-based program, and it anchors the officers to the community and make those connections and how to navigate through the system as well as the peers. So it's not just, myself and all the subject matter experts that come in, it's law enforcement saying, you know what, you were right, 5 days a week, no virtual, let's do it.
So Mark, I'm going to ask you, and then I'm going to turn the question and answer back to Michelle since she's back in. But so Mark, you're in more of a rural environment. You're serving multiple counties, which, again, presents different challenges than maybe is faced in Miami-Dade. So what are your thoughts moving forward? How do you see the future as far as training and more use of technology working out, or segmenting the training?
Yeah, we've not really had a big push to do segmented training. We've talked about it internally as a training team before as a possible way to get the training to more officers. But we really realized very quickly that there's so much momentum built up through that 40-hour week. On Wednesday, I'm referring to things that happened on Monday. And if I had to do that 3 weeks after we had the first Monday session, I don't think it would work nearly as well. We have had agencies that we've trained that only have a handful of officers, and it is very difficult for them to free up an officer for 5 days. They have to do a lot of work to provide coverage for that person while they're not out on the street. And I think a lot of that shows our community's dedication to having the training, that they will jump through those hoops and go through that process to make sure that things are covered, and they find the training important enough that they want somebody on their team who has gotten this training the best way that they can get it. So that's kind of been our stance on it, is that we haven't really delved into the idea of doing the segmented training before, because it just hasn't come up in our agencies.
So I'm guessing we've got about 30 years of collective experience, at least amongst the three of you, saying really it's the momentum. You really do need to get people together to the extent that you're able to do that and have those resources. At this point, Michelle, I'm going to turn it back over to you to lead the question and answer.
Thanks, Dan, and I apologize to everybody that's in attendance that I lost internet connection. So the beauty of all this is we're all a team, and it's all about relationships and maintaining relationships. And when one goes down, the other picks up. So I feel like I'm in good company with a lot of great people. So as you were discussing some of the things around the training, another question, sort of focusing back on the relationships and sort of how many of you maintain the relationships. One question came in that you mentioned the more frequent or smaller meetings held virtually as a way to maintain or develop relationships. But what kind of challenges, and maybe I'll start, Topsy, with you, and then Mark will move over to you, and Captain Law. What challenges did you face in regards to busy schedules and commitments, and how did you overcome these? So if you went from maybe sort of less frequent meetings when you were meeting in person to now more frequent, and probably others were also getting lots more frequent meetings for other reasons and kind of the Zoom fatigue. How did you sort of overcome, or what were some of the challenges you faced, and then some ways you overcame to keep people engaged?
Mm-hmm. Well, working from home during last year, I was saving, really living in Miami-Dade, 3 hours, right? From the minute I get up to the moment that I'm sitting at my desk in my office, 3 hours. So now I had those 3 hours at home. And what I was doing more often, so I wouldn't have to, because, for example, yes, so many meetings, a CIT steering committee, then we have subcommittees, we have CIT collaboration meetings between hospitals and police and law enforcement, and then we have CIT coordinator meetings. And so it's so true that, some meetings is just information that you need to share, and it doesn't necessarily have to be, on Zoom, and just increase the fatigue. So now I had the opportunity to send out weekly just CIT local news blast specific to CIT coordinators, or maybe to the partners of one local hospital and their nearing police departments. So there was more a news blast, one-page weekly, updates. And so that way they could just, just read it and receive it via email. And that would also shorten the time that we spent on Zoom. And when it came to the 8-hour virtual classes that we did, the intro and the refresher, I also broke them down at times into 2 days. So really 3.5 hours, and the next day 3.5 hours. So trying to provide that variety instead of just everything on Zoom, because it can also become addicting.
Thank you. Mark?
I really echo a lot of what Hopsy said. We found out very quickly which things could just kind of be a quick email blast of information. We're doing these trainings at these dates. Here's what I need from you guys, and send that out. And then which things really needed some more discussion and conversation. And we would try to save the Zoom stuff or the phone calls for topics that really needed that kind of conversation and discussion. And then instead of having big committee meetings that would cover 3, 4, 5 counties worth of individuals and agencies, if we were doing a training that just was going to cover 1 or 2 counties or agencies, we could focus that conversation just on the people that were going to be involved in that training. That way we didn't have to try and schedule around the difficult schedules of folks who weren't involved in that particular training, and save their time for instances where we really needed their input on things that were going to impact them directly.
Great, thank you. So, we talked a lot about the importance of data and, information sharing and, being able to speak to what creates success. So I've got a couple questions I'm going to throw out and, see who would like to start. But so what do you all see as some key indicators of success for building and maintaining relationships between community providers and law enforcement? We speak about the value of the relationships and how you actually go about creating these relationships, but has any of you sort of looked at what are your indicators to know that you've been successful in getting that buy-in or getting the sustainability of relationships between, community providers and law enforcement in this work?
Well, if I may add, we've been spending a lot of time now more recently in having behavioral health shadow law enforcement, and spending some time just last week at their call center. And so it's the feedback that we're getting back from mental health professionals. They had no idea. They now understand more of the crisis and the mental health and the importance of wellness of law enforcement, spending time doing ride-alongs, just understanding their procedures, and vice versa. We've had some officers shadowing some of our mental health professionals and physicians at facilities. And when you give them that experience, walk in my shoes, it's just such an awakening. And now we find that there's more feedback, more positive, more understanding, along with more cooperation, more inclusion. Let's invite them. Let's have them participate in this. And it's just, just again, walking in each other's shoes has made a significant impact on both sides and the community, because we also include our peers and our advocates to just experience, the other side of things.
Thank you. Anybody else want to have any further insight on that?
I will say I aggregate the CIT contact report data for our program. So when our officers have a contact, they do a report, and part of that is filtering it down to me so I can keep up with all of the aggregate contact information. So being able to see, which agencies are really giving me a lot of reports, which agencies are out there on the street using the program, helps me figure out, which folks are really putting it into practice and which areas of my area or my counties got the training just because it was, the thing to do at the time. And we can kind of focus in on what are we missing in those areas if they're not out there really using those skills, engaging with the community. What can we do to increase that relationship in that area? I can also see from those reports, are my officers getting in contact with community agencies? Are they getting a hold of mobile crisis response from mental health on the scene? Are they working together, or is there still a silo of information and they're not really working together as much? And if I see that, I can bring that into our meetings, our trainings, and kind of address it and figure out what's the holdup there and how do we increase the relationship between mental health, law enforcement, and the community in that particular area.
Great, thank you. And I think that sort of segues into this next question as far as, there's always concerns or questions or confusion related to data sharing or information sharing among behavioral health and law enforcement that can support successful diversion. Did anybody see a decrease in information sharing or an increase in information sharing particularly during the pandemic? Was there any change, you think, in how the communities work together to share, or were continued barriers that you as community teams have to, sort through?
I will say that during the pandemic, I believe the information sharing actually become more prominent because my officers was out there on the scene and they already had built that personal relationship with everyone, and they were directly in more contact because there was limited beds available, there was limited resources available during this time because of all the things. But it seemed like the information sharing to come to a good resolution and a good de-escalation, but happened a lot more during the pandemic.
Great. Yeah, go ahead. Were you going to say something, Hopsy?
No, just I concur, absolutely. And it definitely, increased the need for data sharing. And, we had always a partnership with fire rescue, but more than ever during COVID. And, it was many times, of course, the same individuals that they were all encountering. And so that just brought us together to huddle even more so and say, okay, how do we streamline an effective approach in meeting the needs of individuals that we're all seeing regularly?
Great. And I think we've all learned that the more we can build these relationships and the stronger they are, it allows you as a community to work through barriers on how best to share information that can promote diversion, promote safety, and promote connection to treatment. So everybody becomes much more educated together to find ways to make that work. So, Amy, I may start with you, and actually Captain Locke, I may ask you to also weigh in. Amy, I'm kind of looking to you sort of from the researcher, and you kind of keeping an eye sort of in that regard, but how might, what does policing maybe look like going forward, particularly since the civil unrest and the ongoing discussions related to racial equity and discussions around the role of law enforcement in mental health related calls? So there was a lot of talk about sort of what the responsibility is of law enforcement in mental health calls, as well as sort of their role and impact related to the civil unrest. So what are you hearing, seeing, or what are your thoughts about what policing may look like going forward?
Michelle, did you want me to jump in? Or?
Yeah, I'm sorry. I wanted you to start, Amy. I'm sorry.
I mean, I do think moving forward, as we see more and more communities looking for options to shift some of the responsibility for many of the mental health, social service related calls that police are currently responding to, I think we're going to see that push continue. And we're going to, it's going to take some time to develop models and workforce capacity to actually have non-law enforcement professionals responding to some of these calls, but I think we're going to see that move forward. And I think, you know, that's where partnerships become really, really important, because I think that police will continue to have some role in responding to mental health crisis. There's certainly situations where they're needed, but if we're shifting some of this responsibility, that moves their role into more as an assist role, as opposed to the other way where they're primary with mental health assisting. And I think as we move that forward, partnerships will be really key to working out how we do that. And I do think that that will start to address some of the concerns right now, in the need for kind of changing policing to some extent. Is what we're seeing is many communities of color really saying that we want police to have less of a footprint in our community, particularly for non-crime related issues. So I think, you know, communities and policing will have to be responsive to those concerns, but partnerships are really going to be the foundation of being able to do that well, while we address the needs of communities.
Thank you. Captain Locke, would you like to weigh in from a law enforcement perspective in terms of, you know, policing, you know, what it looks like going forward, particularly around the civil unrest and discussions with racial equity and role of law enforcement in the mental health crisis calls?
I would agree with a lot of stuff that Amy said there. It's definitely going to have, there's going to be some changes made on actually both sides. We're going to have to come together with the community and focus on community-driven efforts to address crime and safety issues that could be handled without law enforcement intervention. But at this time, you know, we're just trying to promote more of the community-oriented policing programs. That way we can have a reduction towards anything that could be considered a racial disparity, and try to have better outcomes when they're dealing with the criminal justice system and the involvements and things towards that effect.
Great, thank you. Thank you, really appreciate it. Since we're sort of on the big picture sort of topic in some ways, I know, Amy, you started the presentation sharing the survey that CIT International had done, and that there's also was other surveys done, IACP and others, and I think Roxanne had talked about some surveys or information that had been gathered across the field. And I'm hoping I'm understanding this question that came in, but do you believe that any surveys that have come out of this trying period pertaining to officer sentiments on new trainings would actually capture the sentiments on changes in policing and not the changes toward the new tools?
I think most likely surveys going out in this current period will probably capture some of both, because there is, you know, we're in a period where law enforcement is under a lot of stress, and I think that's going to impact how they're looking at, you know, the questions they're being asked about these new tools. So yeah, I think whenever you'd be interpreting the findings from surveys like that, you'd have to keep that in mind of what is the historical context that the questions were asked in.
Okay, thank you. Since many communities are engaged in through their partnerships and sort of work around addressing the needs of people in crisis, people with mental health crises, and looking at the discussion on racial equity, is anyone, are you aware of, do any of you actually track socioeconomic data related to CIT calls that could be utilized to inform some community conversations looking at these issues? So that might go, oh, go on, Amy.
Sorry, I mean, I think certainly some CIT programs have, you know, specific data entry on CIT calls. I think one of the tools that could be useful in sort of looking at socioeconomic data would be looking at where we can geocode where calls are occurring and looking at neighborhood characteristics. And that could be useful for informing, our assessment of, are these initiatives serving, all communities equitably? Are there different needs in different communities? So looking at it from the community level, I think we have some good tools to do that. I think there's some efforts that are starting to try to do that now. There's not a ton in the literature just yet, though.
Great. So CIT International, or even maybe IACP and others, do you know of any plans or what the focus will be to continue to track and sort of track and look at the changes going forward to see, based on how communities responded during the pandemic, to ensure much of their relationships and responses continue to meet their community's needs, but as it has created some changes in how communities operate, do you think there'll be some efforts to see which of those changes actually took hold for long term, or changes that took place but will sort of drop off, from being used?
I think, hopefully, the IACP, George Mason's survey, I'm not entirely sure where the funding's coming from, but hopefully they'll be able to continue to do multiple waves of that study. Certainly CIT International, one of the things, because we do have a membership, we do have the conference, that's another opportunity to engage people and get that feedback as well. And I think that's a really good idea. I do think that some of the strategies that have come up during these crises really are useful and can inform kind of how we move forward in hopefully more normal conditions, because they do have value.
Yes, yeah, thank you. And as we know, oftentimes crisis produces opportunities that really lead to, some really good situations. I want to go back to some other questions that we received that have to do, again, sort of with the relationship. So if there is not an existing relationship with law enforcement or with a law enforcement entity, what would you recommend are some of the best approaches to build a bridge between a law enforcement agency and collaborative courts or specialty courts, where if one wants to build a relationship between law enforcement and courts, utilizing some of the methods you've focused on with building relationships with law enforcement and community providers, how might you advise, if there's no relationship that exists, how do they get started with that? And that might go Mark or Hobsey and Captain Locke.
One of the things I think that we found helpful in building some of those new relationships with different programs, law enforcement agencies, other community partners, is being able to come in and highlight what the benefits are to that program. So when we came in first to some law enforcement agencies, our CIT coordinator and mental health director here were able to say, here's a program that you're not doing that we think can help you, and it can help your officers, it can help your community engagement. Will you try it? And just being able to kind of sell it on, this is a thing that can help you do your job better, easier, whatever the benefit may be. So if it's between law enforcement and specialty courts, being able to say, here's a program that you can help get people into, and this can offload folks from your radar if that's a problem for you, right? If that's clogging up your kind of system flow, right? If you can get them into this program, it can be helpful to you. And once they see the benefits, then you can start to have more footholds in to help them understand what the long-term benefits are for the community in general, trying to get them involved in that long term.
Yes, and it's also extremely helpful to have a champion in your community You know, whether it be a sheriff or, you know, or a judge, like in Miami-Dade County, Judge Leifman, as a public defender, tried to gather the community and no one showed up to his meeting. He tells his story. But when he became a judge, it was standing room only. And so that gave him the opportunity to bring in all the right people in the room to speak of all of the benefits of collaborating and coming together. And also, you know, establishing a CIT program, there are so many benefits because in some communities you have many coordinators, but you also have perhaps a regional or a county-wide or a state coordinator. And that person can really coordinate and centralize and be the glue to keep those partners connected and bringing in new partners. And the longer you have that position, you know, the more stable and the greater foundation you have to keep bringing in those partners and introducing new partners and grow your collaboration.
So in terms of starting a CIT program or starting to, you know, try to engage across the aisle, if you will, with the law enforcement community and the behavioral health community, if someone is doing this for the first time, they don't have anything really established and they really want to get something established, sort of what do you recommend? Where's their starting point? Sort of how do they start that? How do they, you know, open up that conversation and that dialogue?
Mm-hmm. You know, really, I can speak to Miami-Dade and as well throughout the nation. We're very grateful to have our partners from NAMI, National Alliance on Mental Illness, and coming from our program, you know, who provides the training and the program for Miami-Dade County is through the courts. So there was no mental health expert within the courts, and the courts, our judge reached out to NAMI, worked with NAMI, and then reached out to the CEO of our county behavioral health hospital. And it was just reaching out to some key individuals of all disciplines to start with a roundtable, to start pulling the mayor, you know, inform the mayor. We did establish a mental health task force and brought all the key partners and stakeholders together. And so we went from there to grow our program and to come together.
Great, thank you. Mark, Greg, you got any things to add in terms of, you know, communities sort of just starting out for the first time and they really don't have many of these relationships, sort of who steps up and how do you get the attention of law enforcement?
Well, getting the attention of law enforcement. Well, my suggestion would be is once you establish stakeholders and you get everybody that's buying in, and when you approach law enforcement, then it becomes to what we can all do to come up with a really good solution. And when you start talking about decreasing time, manpower time on calls, increasing coverage, building all the relationships and everything, that's going to be the key selling point with law enforcement. And it just runs into towards manpower issues and things towards that effect. But there's so many positive outcomes with CIT. I can't speak enough about it.
And I'd also like to share with our audience that if you do go to citinternational.org, you will find our CIT implementation guide. You can download it or you can purchase, and it takes you step by step on how to initiate and start, implement, grow, sustain, and maintain your CIT program.
Thank you. Yeah, thanks for sharing that. That's a very valuable document that really does break it down for communities that are just starting out, particularly again to develop a CIT program. So we've got a few questions that go back sort of to the direction of the role of law enforcement in mental health calls and some of the things that we're seeing coming, sort of on the horizon with the 988, but is there a recommended curriculum for training emergency communication or 911 dispatchers related to mental health calls and being able to be part of, transferring calls over to a crisis line?
So I know, I believe they've created one, that Mark has created one. I don't know that there's a recommended specific model, but there certainly are a number of communities that have developed some good trainings. In Oregon, they're actually doing some training statewide that was originally developed by the Bureau of Emergency Communication for Portland. And so they have a good 2-day model, but a number of places also have 8-hour versions of it as well. So there's not a single model, but I think we're starting to see more options out there. And, as a researcher, I always look for, which ones have been evaluated. And I think hopefully in the next, year, we'll start to see some evaluations to provide some information to communities in selecting, specific models.
I'll say we didn't have a particular model or extra curriculum that we went off of. We took our already established 40-hour CIT curriculum, and we determined the best way for us to go was to take that curriculum, squish it down basically into a couple of days of didactic training to tell our dispatchers and communications folks, this is what your officers are getting, this is what their information is about mental health, this is some of the information that you can get that might help them assess the situation quicker. And then we gave them a couple of days of trainer training, basically. So we took supervisors from those agencies and said, this is how you train it. This is what we're looking for. Now you can take it back to your, floor staff folks and make sure they have this information training. And we did the full thing with them. We did role plays where they would de-escalate folks on the phone. We got folks from their law enforcement agencies, and so their actual law enforcement partners to come in and help with that. So they would we made sure they were building that relationship between their CIT officers that they would be dispatching, and tried to help that relationship flow a little bit better.
Okay, thank you. Sort of kind of in line with that, and ask Captain Locke to maybe address this, starting from a law enforcement perspective, but also invite the other presenters to chime in. So as we've talked in some of the earlier questions, about the shift of the role of law enforcement in health calls, crisis calls, kind of reducing the footprint, that sort of is a movement going forward as possible. Are you hearing anything, or are there any concerns about getting law enforcement buy-in to some of these programming shifts that may limit their responsibility when they've been used to being the first responder to these calls for decades? Are we hearing there might be some pushback or some concerns about creating a shift of the role of law enforcement in the response to mental health calls? So Captain Locke, I'd like to maybe start with you from law enforcement and see what you might be hearing or thinking as it affects the role or the shift of responsibilities with law enforcement.
Well, there has been a little bit of shift towards law enforcement for handling the calls, because usually they're the first ones on the scene. But that's where I think that the CIT training is coming in to be an excellent tool, because it's giving these officers an opportunity to have more options than what they were originally had to deal with these situations, and to try to keep the criminal justice system out of a situation where they normally wouldn't be needed. And that, I believe that's where it's making the most impact in the communities right now. It's just the officers being aware of what's available to them, and building those partnerships and having those direct contacts where they can text people on the phone, call people, and they can put the in-person training makes them be able to put a face with that person they got on the phone. And it's definitely built up our relationships with our community leaders and our community service providers. and the officers in general. And it's made a big perspective about their well-being here at the office also.
Yeah, that's really some good insights, and really speaks to the value of, giving the officers the tools through CIT, but those relationships may make the shift of responsibility easier because they're really a lot of support together. Hopsy or Mark, any thoughts on that?
I think Captain Locke did a great job. He covered it well.
Okay.
I'll say in our training, we try and tell our officers, the folks that you're dealing with on the street that have mental health issues, substance use issues, that they can be better served elsewhere. We want you to get them to those resources, so that those folks can handle those situations, and you can get back to policing in the way that is best for you. And so giving them those resources allows them to offload those calls that are difficult for them to handle because they don't have the specific training or resources, unless them get them into a system that's going to help those folks a lot better. So I think there's been a lot of positive buy-in towards that because it helps them streamline their job a lot better.
Absolutely. Great. I have a question that came in related to peers and utilizing peer support specialists on crisis teams. And for some that may not know sort of the whole CIT program model, even discussing sort of the role and the involvement of peers and people with lived experience, within a CIT program, but also in responding or being part of a response to crisis as part of crisis teams. So Hopsy, would you like to start with that one?
Sure, absolutely. Yes, I think it is essential. It is they are the core of why we do what we do. And so we speak around people with lived experiences sometimes. What do they need? What can we do for them? How can we help them? Let them speak. And not only let them speak, let them show us. And I find that one of our police departments, Miami Beach, their homeless resource unit has a person with lived experiences, a peer, and he was homeless at one time. And so if no one can convince that person, he can absolutely influence that person to recognize that that they would benefit from some help. So from training to operations to advocacy, peers are at the core of our success. So absolutely 100% they should be included.
Thank you. Mark, in terms of the utilization of peers within your CIT program and even within sort of community crisis response, can you address how you all are focusing on that?
Training wise, we try and implement as many peer conversations as we can throughout that 40-hour week. For the most part, we've got at least one person lined up to come in every day and talk about what their experience is, particularly their experience with law enforcement in times that we're in crisis. I found that that's really the turning point for a lot of our officers, is hearing from that person, this is what it's like. This is what didn't work for me when officers came to me in the past. This is what you might could do to help me better in the future. And I found that I can tell people all I want to about academically what schizophrenia is or what bipolar disorder is, but when they talk to somebody who has really lived through that, it opens a lot of eyes to what that's really like. And I think it changes a lot of the hearts of our officers and kind of gets them to really take that next step into the buy-in. So it's not just now some training that might help make my job easier, but it becomes, this is training that will help me affect my community, affect real people, affect their lives. So I think that's a huge part of what we do. And if we, had to get rid of portions of our training, that would be the last thing we would ever want to touch, is our folks with lived experience coming in to give that information and that resource to our officers.
Yeah, I think what we see is it really helps with that building of empathy and that connection, that human connectedness. And I think as Hopsy pointed out, we wouldn't be doing this work if it weren't for the people with lived experience and we all wanting to improve conditions, improve access to care, improve supports, just improve quality of life. So Yeah, as you're saying, it's very central. And so anybody, that's part of the present, participating today, if you're a peer and you want to get involved with CIT, certainly, contact your probably police department to see if they have a CIT program. But going back to an earlier question, we have found, and Hopsy mentioned NAMI, National Alliance on Mental Illness, oftentimes peers or family members are the ones that get the conversation started to start a CIT program. It doesn't always come from the behavioral health or the mental health providers. It doesn't come from law enforcement necessarily. It comes from people that experience the system and really would like to see the changes and the connections. So that would be good. And so that leads to another question that, if somebody's interested to become involved with a CIT program, to become a trainer within the program or to become a facilitator, how do you recommend they find out if there's a CIT program in their community? Hopsy, Mark, Captain Locke, any thoughts on how people can find out what's going on in their community?
If I were going to tell somebody to reach out somewhere, it would either be find out where your local mental health center, your behavioral health center is, or reach out to your local NAMI, because there's probably going to be one in your area, and they're most likely going to be involved with any kind of CIT training. And they are going to be more than happy to point you in that direction to get you involved in that training, because my experience is that they want as many people from their community to be aware and involved in that training as possible. So they'll help you get in and figure out where that's happening in your area and how you can connect with that group and be a help to them.
Mm-hmm. And we spend a lot of time providing CIT orientations and making sure that our information is, throughout our community. We have a list of all of our coordinators for all police departments, and so the community is becoming more aware of just. If you don't know who it is, call your local police department, ask to speak to the CIT coordinator. But everyone is welcomed and invited to our CIT meetings, and we're happy to share the information and make sure that it's out there.
And I agree with them completely. The more people involved in the program, the higher success that the program's going to have. Volunteers are essential to the program.
Success breeds success, right? And strong relationships breeds stronger relationships and ongoing relationships. So that's a good point, Captain Locke. We are getting close to being out of time. I just have maybe one or two other questions we'll probably have time for. This sort of diverts back to some earlier conversations related to things that occurred because of the pandemic that sort of forced communities and law enforcement to do things just a little bit differently. And that has to do with the use of iPads, the use of telehealth. We know we've seen, even pre-pandemic, some advancement of telehealth in rural communities, to ensure access and reach to people in need. But again, sort of maybe I'll start with you, Amy, and then hear from some of the other presenters as far as chiming in. So how do you see the role of telehealth or the use of iPads going forward? Do you think that may be one particular strategy or effort or initiative that will take hold and continue both for urban and rural communities? And how might that, sort of help with future outcomes for better engagement and retention with services? So what do you foresee the future with iPads and telehealth with law enforcement?
I certainly see, moving forward, that law enforcement, if they are out on the scene responding to a crisis, certainly the use of having a clinician they can contact via an iPad, or if it's just via phone for consultation, is a very useful thing to have. You know, ideally, we could make that connection to a clinician just between the client and the clinician and pull the law enforcement officer out of there. So if people have expanded access to care, crisis care, and ongoing mental health care in the community, we may actually see less demand on police and other emergency responders as well. So certainly, you know, I do believe that we will see continued use of it. And I see particular benefit in rural communities where they may have less access to mobile crisis teams just because of distances. So providing some type of connection to a clinician via iPad and telehealth could be very useful for law enforcement that are actually there on scene.
Thank you. Anybody else want to give your thoughts on how you're seeing in your communities, perhaps the ongoing role?
Law enforcement was definitely, you know, forced to kind of look outside the box during COVID, and that is when some agencies did start using some of the iPads and telehealth, and they have their feedback is that it's been very useful and they will continue to use it. And so, of course, now other police departments are exploring it. And I've also found that when it comes to law enforcement and their wellness, when an officer does reach out to me, now I can tell them about the option of teletherapy, because so many times they say, well, it's at a distance, or it's too far, or it's too much time, takes too much time. Well, there's also teletherapy. And so I'm getting some good feedback on that as well for officers to be more encouraged to think about therapy. And it's not only our officers. I want to say, you know, I learned very quickly that they were saying to me, I'm okay, Hopsy, it's my spouse. They're having a hard time with this. They're afraid for me. They don't want the children to, you know, become contaminated. There's a lot of stress. So a lot of family therapy has been happening. And so I just want to thank law enforcement and all first responders for what they do.
Thank you. Thank you. And that was a nice way to sort of end, because I think the piece about officer wellness is so critical, and giving the officers options to find ways to get the support they need, maybe outside of the traditional system that maybe hasn't, you know, is not something they may want to sort of reach to. So I think that was a good piece of added information. So there were some questions, unfortunately, we didn't get a chance to. What I want to do is encourage all participants to utilize the resources it Gaines, SAMHSA's Gaines Center. There is a number of good publications and information. Also, we had a robust conversation about CIT programs and all the innovative and creative things communities have done to address staying connected in the relationships, as well as being able to still continue to reach out and help people in need. So, you know, visit CIT International's website for resources and connections. You've got some wonderful presenters here who you will have access to these slides, so you will have their contact information, and we encourage you to please reach out to our presenters for additional contact or to answer questions that we didn't specifically get to today. So sort of in wrapping up, I just want to sort of bring it together. So, you know, it was pointed out at the beginning that, you know, this past 18 months really has been quite challenging for the relationships with law enforcement and the community and people with lived experience and others that are in distress. And I think what was really very enlightening and helpful from our presenters is that they outlined many helpful, innovative strategies that communities have been, you know, creating and developing to address the ways to remain connected, to continue to build those relationships, actually engage new partners, and to sustain the relationships. And that these all can be used going forward, you know, post-pandemic, as well as to assist communities with some of the difficult conversations going forward around racial equality, and addressing, solutions for communities to be as healthy and as inclusive as possible. Amy gave the sort of the big picture look at some of the information that came out of the various surveys, which was very helpful. And I think obviously that information drove many of the initiatives, the innovative initiatives. So that was really helpful to hear sort of across the board. Hobsy was able to give a snapshot of not only her community, but things in Florida that were working, for communities to be able to stay connected with their law enforcement partners and nurture those relationships. And then Mark and Captain Locke did a nice job sharing their local community and how they rose to the challenge, particularly to ensure that the training for officers continued and continued in a way that was effective and important to keep the momentum of their CIT program going. So again, collectively, you all provided a wealth of information, a wealth of ideas. We can't thank you enough. And we do hope everybody that was here participating really got a lot out of it. Look forward to this will come out on Gaines' website. And there is a fact sheet or a guide sheet that is going to be produced and coming out in the near future that has some guidelines or guiding ideas for communities. So that's something we're looking forward to putting out. So with that, we want to wish everybody a wonderful rest of your afternoon. Want to thank our presenters again, and we wish you all well. Take care.